I held it up and I tried to channel happy dog thoughts towards Cerberus. Alpo commercials, cute little puppies, fire hydrants. Rick Royden. Welcome to the show dedicated to helping you not just survive retirement, but to have the confidence to lean in and rock it. My name is Roger Whitney. And if you want to retire prior to Medicare age of 65, you will have to battle Cerberus, the three-headed dog that guarded the underworld. In this case, there are three major challenges in navigating healthcare before Medicare, and we're going to talk about them today. And this is going to kick off a month-long series on navigating healthcare before Medicare. And today we're going to talk about the challenge. Next week, we're going to talk about the options that you have for healthcare if you're not at Medicare age. Then we're going to talk about how to optimize and navigate the incentives around ACA subsidies, etc. And then in the last week of the month, we're going to talk about how do we bring this all together to get an action plan so we can slay Cerberus and have a strategy so we can retire before we are Medicare age. So that's the plan for this week. And every week we're going to have listener questions that we're going to answer. We're going to do a smart sprint today. Because this is the first episode of the month, and we're starting this in February, we're going to have at the end of the show what's on our bookshelf, what I've been reading, what my team has been reading, maybe give you some ideas to enhance your reading throughout the year. We'll do that at the beginning of every month. If you want to get a summary of the show and links to books and resources that we mention, I encourage you to sign up for our weekly email called The Noodle. I love that name, where you can noodle every Saturday on how to rock retirement. You can sign up for that at thenoodle.me. And cool thing is when you get that, if you hit reply, that actually comes directly to me. And so you can ask a question, correct my pronunciation, give me some helpful hints, and maybe share some wisdom. So you can do that at thenoodle.me. All right, with that said, let's get this party started. Today, we're going to start the series on healthcare before Medicare, and we got to set up what are the challenges that we face. And we're going to use Cerberus, which was the three-headed dog that guarded the gates of the underworld in Greek mythology, as our image of what we have to battle. We want to navigate healthcare before Medicare. We're going to have to get past the three heads of the healthcare Cerberus. Now, Greek heroes were successful, but they needed a strategy. And you're going to need a strategy to navigate these challenges. So today we're going to set up the challenges. Next week, we'll talk about some options, some tools we have to approach this three-headed dog. All right, what is the first head of this healthcare Cerberus? And that is the expense of paying for healthcare without having an employer plan. So when you retire, assuming you worked at a corporation that had healthcare, you're going from a subsidized plan to a non-subsidized plan. And that can make healthcare seem really expensive, perhaps for the first time. But the real truth is that it's always expensive. It's just that you're not getting an employer subsidy to help pay for what healthcare is. It's all on you. And as a self-employed individual, I can relate to this, and we'll use myself as an example because I've had to navigate this in being self-employed. And so what do I mean that it's not just suddenly expensive? It's always expensive. So I'm going to go to the Kaiser Family Foundation Annual Employer Survey for 2024. Now, Kaiser Foundation, when it comes to healthcare before Medicare, is a great resource, and we'll have a link to that in the Noodle. They have some ACA resources and some calculators, and they do a lot of research on this. But according to their annual survey, if you are single and working at a company that has health insurance, the average total premium for a single person is about $8,950 a year. And the average employee contribution is about $119 a month. So about $1,430 a year. Now, that doesn't mean that's what healthcare costs when you have an employer plan, because the average employer contribution, according to their survey, is about 84% of the premium, or just over $7,500 per year. So healthcare is expensive for a single person. Even if you're working, you just have the employer benefit of subsidizing that. Now, for family coverage, according to the Kaiser survey, the average premium on an annual basis for family coverage is $25,500 a year. The average employee contribution, so this would be you if you're working at a company, on average anyway, is $525 a month, or about $6,300 a year. And the employer is picking up 75% of the premium, or just over $19,000 a year. So we're talking $10,000 to $25,000, depending on whether you're single or have family coverage. But when you're working, the employer picks up the lion's share of that, so it seems much more reasonable. But then when you retire, all of a sudden the employer contribution to your healthcare goes away, and now it's you. And that is what makes it seem like such a sticker shock, is because you never really see the employer contribution. You don't see it on your W-2. You don't see it typically on your compensation summary. It happens in the background. And this is the burden that employers have, that is real money towards employee compensation, that just goes away. So to use as an example of this financial impact, I'm just going to use my wife and I, Sean and I, when it comes to finances. Now, we are under the ACA program, the Affordable Care Act, which is the government scheme to try to get everybody covered. And the nice thing about the ACA is when you enroll in open enrollment, they can't exclude pre-existing conditions. But if you're not getting any subsidy, the cost is roughly the same. So Sean and I pay, and I'm rounding here, $27,800 per year for coverage for her and I. And that's with zero subsidy. So we're paying a little bit more than the family coverage average, according to the Kaiser Institute. And then each of us has a max out of pocket. We'll round it here. We're just going to use round numbers, about $10,000 each for max out of pocket. And because of Shauna has a particular ailment, psoriatic arthritis, she hits that in the first month and a half of every year, because the biologic type medicine that she takes costs a lot of money. And so out of pocket, if you're getting no subsidy, and I'm 59, Shauna's 60, and we're paying almost $40,000 a year, most of that being premium. So that's a challenge. If you don't get any subsidies from the ACA, we'll get into that later in the series. This is a big shock. And one is you have to have the money to be able to pay it, and for however many years you are until you hit Medicare, you're going to have to navigate that financially. And navigating that can come with some issues. So when you're battling this head of the Cerberus, you're going to have to find where you're going to get the money. Now, if you have after-tax money in savings accounts or after-tax investments, that can help fight this head of the Cerberus. But if your lion's share of your money are in pre-tax accounts, an IRA or a 401k, well, you may have to draw money from the IRA and the 401k in order to pay this portion of your retirement expenses. Because the money's got to come from somewhere, right? And if it comes from pre-tax accounts, it could exacerbate everything. What do I mean by that? Well, let's assume you have to pay $25,000 a year for healthcare because you're getting no subsidy, and the only place you have to get it is your IRA. Well, that means you need to take $25,000 out of your IRA, but then that becomes taxable income. So you actually have to take more than $25,000 out in order to get your 25. That means if I need to net $25,000 in order to pay for my tax bill, assuming I'm in the federal bracket of 12%, not including if I have state tax, I'd have to take out $28,400 in order to get my $25,000. So I'm taking out more money because I'm incurring this taxable expense. Now, that's going to increase your tax bill. It also could move you up tax brackets in the event that you already have a lot of taxable income. It could move you into the 22% bracket or the 24% bracket. So there's this second order consequence of having to cover this bill. Another one is if you're using are trying to use subsidies for the Affordable Care Act to help offset the cost of your premium. And we're going to talk about that in episode 3 of the subsidy structure as it is today with the Affordable Care Act, where you can get government assistance essentially to help offset your premium. Well, that's based on your modified adjusted gross income. So if you're taking money out of an IRA to cover your ACA insurance premium, it's going to increase your income, which may lower your subsidy. Oh, it's starting to get confusing already. This is a nasty head of a Cerberus we got to manage. And then if you're closer to Medicare, taking money out to cover your premiums could increase your income, which could potentially throw you into IRMA brackets. Just a lot of stuff going on here. So the financial challenge, this head is one that we're going to have to navigate and figure out. So the second head of the Cerberus is the fact that you have to change your healthcare services. Before you retired, if you've worked at a company for a long period of time, you've likely been on the same plan or similar plans for decades, and you have the doctors that you like. You have a rhythm in operating how to navigate claims and filing and prescriptions, etc. But when you retire and you look for alternatives, generally in the Affordable Care Act, under the Affordable Care Act, a lot of people will experience what's called the narrowing of your network. Your options get less attractive because corporations, they're able to have collective power and relationships. So you probably have a relatively robust plan if you're at a large corporation. Well, now you're going to go likely into the network, the Affordable Care Act. Again, we'll talk about that next week, where your options could be limited. So you may go from a PPO to an HMO. And that's going to limit the options of your providers, what doctors you're allowed to see. It may limit or increase the deductibles related to your plan. So we see a narrowing of networks because the healthcare network that you're in becomes much more restrictive. Now, this can become, again, exacerbated if you need specialists. Well, one is your current doctors that you've been, before I even get to that, your current doctors in your plan may not be in the plans that you sign up for when you retire. And that's a big disruption because, you're building relational currency with your doctor. They know you, they understand the history, they know the context, they know how to communicate with you. And unless you find a plan that has them in there, you may have to switch doctors. And that can be very disruptive, especially if you're dealing with healthcare challenges. Now, the other part of that is if you have a healthcare challenge that requires a specialist, getting access to those specialists can get a little bit harder. Well, one is you may have to switch specialists because your new plan doesn't have what your corporate plan had. But getting access to those specialists can be hard. One, a lot of them just aren't accepting new patients. And those that are accepting new patients can have long wait times. Your rheumatologist, if that's how you pronounce it, Shauna has one, you may have 3 to 6 months to get to some of these specialists because they're so in demand within these plans. And that just makes it difficult if you're dealing with a challenge. Now, Shauna has psoriatic arthritis, and she has this issue. She has a rheumatologist, I hope I'm pronouncing that correctly, that she loves. And luckily, she's integrated into their practice. So even if they're not accepting new patients, she's in. And recently, we had to re-up or redo our healthcare because every open enrollment period, you can select a new plan. And the plan that she was on last year in 2024-25, it was available to her for 26, but the premium had increased significantly, like $400 or $500 per month. And there were other plans that were less expensive that were very similar, except that this specialist wasn't on those other plans. And she has a relationship with that specialist. She likes that specialist. Everything is working well. So we ended up having to be stuck in this plan and just eat the increase in the cost because we didn't want to lose access to that specialist because that's been working well in managing this health challenge. So you can see how this narrowing can make it very difficult when you retire before Medicare. All right. That's the second head of the Cerberus. Is number one is the money part. Number two is getting coverage that fits your doctors and the challenges that you face, and understanding that you're going to have less options. It can be very restrictive. Now let's get to the third head of the Cerberus, and that is increased complexity. Doesn't have to do with your healthcare, doesn't have to do with your money, but boy, is this a big one. You're navigating having to choose plans without a lot of information and with a lot of complexity. Go to healthcare.gov. Walk through the process. You're going to be comparing, say, two HMO bronze plans. They're going to look almost identical, but the cost is different. And there might be subtle differences that you can't see initially. And we're really not in a position to evaluate that well most of the time. And I can tell you from my personal experience trying to navigate it, someone who knows a little bit about this stuff, it's hard. And I get tired head really quickly. So we'll talk a little bit about how you do that, but it's going to increase the complexity of just simply choosing a plan and navigating open enrollment. And then it's also, once you have your plan, you're going to have to find your doctor. You're going to need to make sure they get on that. You're going to have to navigate the benefit process with your plan and not have a benefits department like you might have in HR to maybe assist with some of this stuff. You're going to have to deal with claims and negotiation with providers. That gets really difficult. Now, from personal experience, more my wife's than mine, she has been on the phone for hours navigating the approval of getting the referral back to the doctor because the referral expired by a day. She's been on the phone for hours with the pharmacy and getting approval for the biologic that they need. This is complicated stuff. It's not a full-time job, but it can become difficult. And that could be even worse if this is an area that you're really not comfortable with. It's a little intimidating. So this is a head that we got to battle. And then lastly, the last part of the complexity is if you're looking to get subsidies from the Affordable Care Act to help offset the expensive cost of healthcare, that can be difficult. It's based on modified adjusted gross income, and that definition means different things for different benefits. We'll talk about that in episode 3. So we got to figure out, how do we navigate how we realize income based off of modified adjusted gross income in order to get the subsidy that we're targeting. And you always have to project beforehand to the Affordable Care Act what you say your income's going to be. And if it's different, they have to reconciliate that. So you might get negative surprises. And, investments have random dividends or capital reinvestments. You get a job or consulting job you didn't know you're going to get, and that has downstream impact on your income, which changes your subsidy, blah, 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 blah. I'm getting tired head right now. Okay. We're setting up the challenges. We got first head, the expense. Second head, coverage. Third head, complexity. Our goal for this series, next week, we're going to talk about what options do we have for healthcare and what are the basics of those options. So we'll talk a lot about the Affordable Care Act. Episode 3, we're going to talk about how do we use the healthcare system, not use in a bad way, but yet take advantage of subsidies if we're due them in terms of decisions we make on how we realize our income. And then in the last series, we're going to try to put together a framework so you can navigate this a little bit more thoughtfully on your own, because it can be slaying. You can get to the underworld, which I guess in this case is retirement before Medicare. All right. We've set up the challenges. Don't get too pessimistic yet, because we should be able to slay this. Now let's get to some of your questions. Now it's time to answer some of your questions. If you have a question for the show, you can go to askroger.me and type in your question. Helpful hint, if you leave an audio question, we try to make that a fast pass and answer those with priority because we love to hear your voice. So today we're just going to go through a few because we didn't do questions last week, or last month really. Andy from New Jersey had a comment on Lucy and Henry, who are retirement plan live subjects. Hey, I was thinking more importantly than if Lucy and Henry can retire, maybe they should explain how they saved over $3 million, paid off their student loans, had a child, paid for daycare, funded their education, paid off their mortgage, all before they were 46 years old. I think these facts need investigation. That's a good question, Andy. And we talked a little bit about it on the live broadcast, but that definitely wasn't the focus of what we were doing. My understanding from my conversations with them is they didn't receive an inheritance. They didn't have super duper stock options that hit, is that they decided early, and this is in their early 20s, so let's assume it's 20 years, that they just weren't going to inflate their lifestyle. So as their careers grew, and they both are in tech, I think on average, would they say they made about 150 throughout that 20-year period? But that wasn't just linear. They grew that over time. But the kind of healthcare or the kind of expenses that they modeled in their planning session that we did mirrored what they've been doing for a long period of time. So they're spending, say, 60, 70 a year, and they're consistently saving to their 401k, consistently saving to Roth. Every extra income that they received, bonus or pay raise, added to the size of the shovel in order to save. So a lot of this was savings based, just simply consistent over time. And as they got more money, they didn't inflate their lifestyle. They didn't buy a car. They didn't start going out to eat more. They watched every dollar, it sounds like. And if you do the math, it works. Because the other thing that they had over those 20 years, except for a brief period here and there, was a great tailwind of markets. They were about 90% equities. And from 2005 to 2024, the 20-year annualized return for the S&P 500 was around 10, 11%. So this is a fantastic tailwind. Yeah, they had 08 in there, but really other than 08, not much. I think they exemplify the power of compounding. And we think of compounding as investing, right? The compounding of returns over time. But the real power of compounding is habits. And it sounds like they have been very consistent in maintaining their lifestyle without inflating it. And they sound perfectly happy the way that they did it. And then every extra dollar they get just added to the pot to all of the things from investing to paying off loans, etc. And they didn't change houses. They didn't upgrade their cars. They didn't go into real estate because they got excited about it. They didn't change their investment strategy that I'm aware of because they thought maybe I should go from passive growth to international growth. I should try private equity, or I should try this. The consistency over and over. They didn't allow novelty, in my judgment, to distract them from the system and the process that they built. And novelty is a big one. Just as an aside, novelty gets us all into trouble, and we love novelty. And our retirement planning process, and I think your retirement planning process, should be really boring, but it should be consistent and not get distracted. I think that's how they did it from our conversation. So hopefully that's helpful. And Henry and Lucy, if you're listening and you want to share your perspective, shoot me a quick email and share me your thoughts. Now, Scott in Virginia only has one pet peeve in his life, and that is the word iterate. He says, Happy New Year, Roger. Please retire the word iterate as well. Love the show. It's my one and only pet peeve. I'll do my best, Scott. Let me pull it out every now and then, but I'll lighten up on it, okay? Our next comment comes, and I don't see the name here, so I apologize for that. And it says, I love your show. Learn a lot from it. Great. Quick question about the 4% rule from this week week's episode. Wade found notes in retirement planning guidebook. By the way, we're going to have Wade on as soon as we get him scheduled because there's a revised retirement plan guidebook. So he and I are going to chat about that. He's been waiting for the healthcare stuff, by the way, before he could get it published. So Wade will be on soon. But in his guidebook, they said that the 4% rule is based on a 30-year retirement period. I've noticed this time frame limitation doesn't come up much in discussion. For someone in their 40s and 50s, wouldn't that be important? I understand this rule still serves as a useful baseline, but I'm curious if there's newer research extending the timeline or if I'm missing something. I have no clue. Oh, it's Angelica. I have no clue if there's more research. I don't think it's something to use at all in retirement planning other than a back of the napkin. And for that basis, I think whether it's 40 years or 50 years likely doesn't make that big a difference because you're not going to use it anyway. It's just for back of the napkin. I reject it as anything more than a heuristic for retirement planning. And so I don't give it that much more thought. And then we had a correction from Jeff related to the same topic. Hey, Roger, love your podcast. Don't want to be that guy. But in the newsletter, you said, if you aren't familiar with the 4% rule, it was developed by a professor. Bill Bengen is not a professor. He's a well-educated, but is a financial planner and author. Great point. That was not correct. He is not a professor. He's a practicing retirement planner, or was, and an author. Next comes from John, who has a question and an observation. The first, I think, is the observation. As I listened to the podcast with Henry and Lucy, I was stunned with $50,000 as their base great life. Living in the suburbs outside of New York City, this would be impossible. Although my mortgage is at 2 5/8, my annual mortgage and taxes is $40,000 a year, and that's before the enormous electric bills, homeowner, auto, umbrella insurance, etc. So that puts me much higher than $50K without eating. Anyway, good for them. New Jersey and New York metro areas are expensive. This is a really good point, John. You have an extreme to where they live because they live in a very rural area in the Midwest, and the costs are just demonstrably different. And that is something we all have to navigate. And that is not just simply, these are two extremes. You're outside of New York City. They're in, the rural area of a Midwest state, which is just a lot less expensive. And yours has benefits and theirs has benefits in terms of lifestyle. But there are other decisions that aren't quite as dramatic that really make a difference as well. And the natural one that I always come back to, and maybe I'm just, it's the one I think of first, is I can remember multiple times doing planning of someone living in Minnesota and them considering moving to Florida. Just based on taxes, not even cost of living, it made a material difference for them to leave Minnesota and go to Florida because of the tax scheme around pensions and IRA and income and all of that other stuff. Literally, they had more money to retire earlier or go if they moved from Minnesota to Florida. It was just dramatic. Now, they had that values choice. Is it worth being in Minnesota versus moving to Florida? Because obviously they have very different types of weather and activities and environment, all that stuff. Then that's the values-based decision. It's very similar to what I'm dealing with in our slow migration to Colorado. I live in Texas. The tax scheme, we don't have a state tax, but we have very high real estate taxes. In Colorado, they have a state tax, but they have very low real estate taxes. There are differences depending on, like in this case, let's take Texas and Colorado. If you don't have really high income, Colorado may be a better place to retire because your income isn't really high, so you're not getting hit too hard on the income tax, and your real estate taxes are significantly less expensive. Versus if you have super high income, Texas is more advantageous. Now, there is this, I take those things into account for myself, but I don't let them drive the bus. I let what I want my life design to be like and then have this as a consideration. But you're right. I get it, John. Now let's get to your question. I have a question on the values worksheet that you shared. Why is question 2 about being angry or frustrated? It made me a little sad when the rest of the worksheet was uplifting and made me happy and reflective in a good way. I suppose it was to be aware of and do not plan a future that would include this. Is there an alternate number question you could suggest? Well, the reason that question is there, John, is it's even when you're trying to find a definition for something, sometimes it's easy to identify the opposite of what it isn't to help you reveal what it is, rather than just trying to identify what it is. So it's meant to triangulate a little bit to get clarity. And we have it at the beginning because thinking about what you don't want helps bring more clarity to what you do want. And I think it's worthwhile exploring that. It's nothing to get sad or depressed about. But finding out what you don't want in your life can help you discover what you want in your life. Let me see if I can use an example here to explain. So like one of my values is adventure. And in the worksheet, I'm trying to remember this because I did this a while ago, a long time ago. But if I start with, well, what is it I don't want in my life? What is it that really frustrates me? Being indoors and working at a desk all day. I'm never at my best self when I'm always just indoor doing stuff, working and watching TV or, I like to be indoors, but that helped clarify, wow, I love it when I mountain bike. That's maybe one of the reasons why I mountain bike, because I'm out in nature. And I realized if I don't have adventurous things a few times a year that are planned, it makes me less of who I am. So it's a way of triangulating it. So hopefully that helps. Next question is related to Henry and Lucy as well. And it's from Jennifer. Jennifer says, love the case study. Question on Lucy and Henry's expenses. How do you model income taxes? Does Lucy's estimate on base case Great Life include the estimate, or do they project taxes in your calculations? Thanks for all you do. Good question, Jennifer. So all the numbers they shared were not including any income taxes. And that is, from a software perspective, being calculated in the background. But also, what I would suggest doing is we always keep a 5-year cash flow estimate in a very basic spreadsheet to know what income sources they have, what their spending going to be. And that way, if we think we're going to take an IRA distribution, we can adjust the income tax estimate based on the amount we think they need to take out of an IRA, et cetera. And in their case, because they had $710,000 in after-tax investments, they almost had no income tax because they have a high standard deduction and they're using their money from their after-tax account. But that's where you would account for it. Whereas if they didn't have that money and they had to take money from an IRA, I know they're 47, so they couldn't, but if they had to, then we would have to adjust the taxes to account for the money that would be caused, the tax that would be caused. So it's not that's not included in their numbers. All right, now it's time to set a smart sprint.
On your marks, get set.
And we're off to set a little baby step we can take in the next 7 days to not just rock retirement, but rock life. All right, in the next 7 days, just evaluate the estimates you have in your retirement plan for healthcare. If you're already on Medicare, put in the Medicare amount and then put in what you estimate as your out-of-pocket expenses, because we're all going to have some of those. If you are not retired and you're before age 65, evaluate what number you're using. Are you using the full boat with no subsidies for healthcare? And that would be for a family, let's say $25,000 a year or $9,000 a year if you're single. Or are you counting on subsidies? Just evaluate what that number is to start to understand this more. And as we go through this series, that will be helpful to refine a strategy for you to slay the Cerberus. All right, we're at the end of the show. We're going to hang out and talk about what's on our bookshelf. We haven't talked about books in a while, and we get a lot of people that like it. So we decided at the end of the show, at the first of every month, we're going to go just geek out on books. So since the last time I talked about it, I've read 4 books. In the middle, I just finished one. I read 4 books that I'll talk about. A lot of these were audiobooks because I've been driving a lot. I've been going to Colorado, 11 hours each way. So So some of these are audiobooks, some of them aren't. So the first one, I just finished this last night, Robert E. Lee by Alan Guzlo. I think I pronounced Guelzo. Forgive me if I'm pronouncing it wrong. It's a biography about Robert E. Lee. I would give it, for me, a 7 out of 10. Good book, well written, told a lot about the Civil War. So if you're into the Civil War, it definitely follows that timeline, really focusing on Robert E. Lee. I felt like I got a little bit of a sense of who he was as a man. Sound like he wasn't that deep of a man from an intellectual standpoint. He wanted emancipation, but he thought it would be gradual. He thought himself more of as a Federalist or a Union person, but out of Virginia, he had a lot of pride in Virginia, and it sort of pulled him down the lane of going to the Confederacy. And he's more of an engineer than a soldier. He ended up being a soldier in general, but was trained as an engineer. Good book. Worth a read if you're into that stuff. Second book I read was Everything is Tuberculosis by John Green. Had heard about this book. John Green really is focused on tuberculosis. This is like his interesting problem. It gives an interesting history of tuberculosis, which is consumption, coughing up blood in the Old West movies, etc., and talks about how pervasive it has been in human society, and even today, because of some of the inequities from access to healthcare in poorer countries, and how this really could have been eradicated, but because of all this mismatch and getting the actual treatments to the right people and money involved and everything else. And what I like about it was it's an interesting history from the viewpoint of using tuberculosis to weave a thread. And I also like that John cares so much about it. He didn't just write about it. He's trying to be an advocate to help improve the treatment for tuberculosis, to help improve human life in areas that it's affected. So good book. I enjoyed it. Next book I read was Reporter by Seymour Hersh or Cy Hersh. He was the reporter. He's like an old school, deep journalist, like Bernstein, Woodward Bernstein. He worked on that story. He revealed massacres in Vietnam. I read this book because I saw a very interesting, I think it was a Netflix documentary on him, which is definitely worth watching. I enjoyed it. But he's definitely like a hard-nosed reporter with a point of view, investigative. Interesting. I'd watch the documentary before I'd read the book, unless you're really into it. Last book I read was from a friend called In COVID's Wake, which was a debrief of COVID and how we all navigate that. It was extremely well researched. Interestingly, it was given to me by a good friend where we had some differing thoughts related to that time and how policy and things played out. And I really enjoyed the book. So if you're into that type of stuff, you can check that out. All right. Now, some books from the team. Nicole was kind enough to leave an audio message. So let's listen to her review.
Hey, Roger and Retirement Answer Man listeners. This is Nicole, and I just finished reading Stacy Schiff's A Great Improvisation, Franklin, France, and the Birth of America. I thought it was a great read. I love history, though, so I was super into learning more about Franklin as a person. I thought it was fascinating to see what was going on in Europe that was influencing the American Revolution. We don't learn about that in history class a lot of times, so I thought that was kind of a unique take that I wasn't aware of before. That being said, it's very well researched, it's very detailed, and there's a lot of convoluted prose, so I did end up having to grab a dictionary a few times. For that reason, I would say a 3-star read instead of 4, but hey, maybe you'd enjoy it too, so happy reading.
I'm going to give this book a 5-star simply because it forced Nicole to get a dictionary, because this girl's vocabulary is awesome. So anything that makes her get a dictionary makes me smile, because she's always correcting my words because she's so smart. All right, I'm going to share a few more from the team. This one's from Kevin Liles. It was written by Jordan Gummett. The Purpose Code, How to Unlock Meaning, Maximize Happiness, and Leave a Lasting Legacy. We'll have links to all of these books, by the way, in the Noodle. So if you want to check one of them out, we can give you a link there. A few thoughts from Kevin. Forget what others are doing. This book challenges you to find your own way to live a life of meaning and purpose. And I love that. You're your own unique person. You can learn from others, but don't follow their script, follow your own. He gives it a 5 out of 5. Our next book comes from Troy Ketzer-Heinrich, a planner in the Retire Agile team. The book is Habits of the Household by Justin Whitmore Early. Troy says, following Atomic Habits by James Clear, I thought this would be a great read, and my wife, Hope, highly recommended it. I thoroughly enjoyed it, and this book is fitting for a parent with kids at home. One thing that stuck out was the family age chart, where you track how old your kids will be at different stages of your own life. This chart highlights milestones and the number of summers you have left with your kids at home. This reminded me of the asymmetry of aging and retirement. Each year is valued differently, with more emphasis on the early years. I'm reminded that I only have now, and my habits compound into who I become each day. So that's Troy's book, a 4 out of 5 he gives it. We're going to do one more here. This is from Mark Ross, Reimagining Wealth in 101 Simple Sketches by Carl Richards. We had Carl on the show where we talked about this before the book came out. Mark says, I am a visual learner. This book is super helpful for understanding personal financial concepts that I could read about at length. But these simple sketches are awesome. It sparks some ideas. I have been creating sketches to communicate in other areas of my life. I am digging this one. 5 out of 5. All right, I got more books, but we're running long on time, and I want to value your time and mine. So we'll do this at the beginning of each month. I hope you have a wonderful day. The opinions voiced in this podcast are for general information only and not intended to provide specific advice or recommendations for any individual. All performance reference is historical and does not guarantee future results. All indices are unmanaged and cannot be invested in directly. Make sure you consult your legal, tax, or financial advisor before making any decisions.